Since we are now, so what I was saying is, listen to the point carefully. The skin around the exit site. When I say exit site, what does it mean? When I say exit site, do you know exactly the exit site I'm talking about? Yes or no? Yes or no? When I say exit site, do you know what actually it means or where exactly it is? Yes or no?
Yep.
I cannot hear you people say, is it a yes or is it no?
Say again, ma'am.
I said, when we're talking about exit site, do you understand what it actually means or where it actually is? Have you seen the diagram where I just now the diagram that I showed you where I said that this is where your peritoneal catheters inserted? Yes? You want to can take the shot again.
And drainage back.
This one right here. Can you see this?
Yes, ma'am.
Yes.
Okay. So I keep saying exit side. That exit side is this portion, this one. Okay, is this part of your stomach. But where this is inserted means you have to clean this. Clean means in a circular motion. Okay, you have to go clockwise like that. Means in your belly, this will be inserted. Right. So this is your exit side. This is where you'll be doing the dressing and everything, the cleaning and everything. Got it?
Yes, ma'am.
Yes, everyone fast.
Yes, ma'am.
Yes, ma'am.
Okay, so around this area, this part where this is inserted, if it's healing nicely, you see there's a pinkish color. If there's some infection or some problem with it, obviously there will be what do you call it? There'll be like a purplish discoloration around this area. In that case, you have to show the doctor. You have to observe that because you'll be doing the dressing, so you have to observe all of that. Okay. So that's
Yes,
what
ma'am.
the third point is all about. I mean, the fourth point is all about. Is you have to check for these if there's any infection, if there's any kind of rashes and anything. Fine. And okay, so again, your fourth point is look for the signs of infection. When you're looking for the signs of infection, in some cases, in this area again, there'll be like a reddish, a kind of allergy. Yes, have you ever seen? There'll be like a kind of allergy that is called erythema. Okay, that is called erythema. Why? Because there'll be redness. Why does it occur? Is because of the moisture. Okay, moisture. If it's very hot, and then if the moisture is like, it's very hot and there'll be moisture. In that moisture, there can be rashes. Okay. Yes.
Yes,
Yes,
When you're
ma'am.
covering, when you're covering this area, when you're covering it, and if there's like it's very hot, and then obviously there'll be moisture, right? Yes. So
Yes, ma'am.
in that case, erythema may be present. Okay. So that is redness of the skin around this area. Yes. Got it? And in some cases, even in this area right here, okay, even there'll be tightness. Then like it'll be very hard. Okay, and that if that is very hard, what do you call that? what is it called? Particular word? This part, in some cases, it can be very tight, very hard. It's like, something, you feel like something is there. The skin will be very, very tight and very hard. What is it called? Induration. That is called induration. Okay. When there's redness, it's called erythema. Okay. That is the redness of the skin. And then if there's tightness or this part, if there's tightness, if it's very hard, that is called induration. Okay, so you have to look for that. Yes. And the last is the tenderness. You have to look for tenderness. That is you have to feel, if the patient feels the pain, you have to ask them, if you're pressing that area, you have to ask the patient if they're feeling the pain. Okay, so that also you have to note down. Means you have to look for erythema, induration, and tenderness. Okay, those are the signs of infection. Okay, yes or no?
Yes, ma'am.
Everyone clear? I'll put this down.
Yes.
Clear, right, everyone?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay, and then, so that is your first point. And your sixth is catheters are connect. Catheters and connection. Okay, catheter is the one I showed you just now. The one that's inserted, that's called a catheter. So catheter and connection should be checked for integrity. What does integrity means? What does integrity means? The catheter and connection should be inspected or should be checked for integrity. What does integrity mean? Does anyone know? Yes, yes, no, fast.
No, ma'am.
No, ma'am.
So integrity
No,
is
ma'am.
means you have to check if the catheter or the connection is stable. Okay. I'll show you what the connector is again. Wait. Oh, yeah. This one, I forgot to show you people just now. This is the your connector. Okay. Do you see this?
Yes, ma'am.
This is your connector between the catheter and the solution and the drainage bag. Okay. This is the connector. This is the connection. This is the catheter. Yes. Got it?
Yes, ma'am.
No. Okay. So you have to check if that is stable. Okay. Yes. Catheters and connectors should be inspected or should be checked for integrity. And integrity means stable. Okay. Done? Understood?
Understood.
Yes, ma'am.
Pardon? Yes, okay. So the exit side should be clean with an antibacterial soap and water and should be covered with a non-occlusive sterile dressing. Should I say? Use that point. I'll give you 7 points. 1, 2, 3, 4, 5, 6. Okay, those are your 6 points. Okay. Your first point is, what is the first thing they should do? Tell me, repeat again. Let me repeat. Your first point is the exit site dressing should be done or should be changed after 5 to 7 days. Okay. Should be changed only after 5 to 7 days after the surgery. Okay, that's your first point. Second is the dressing should be done by who? Dressing should be done by
Trained people, nurses, and
yes. So
technicians.
they have yes. So first dressing should be done by a trained person, that is a nurse or technician, and then taught to the patient. Okay, that's the second point. And your third point is where you should always wear a mask during the procedure of your dressing. Okay, always wear a mask during the procedure of dressing. And that's your third. And the fourth point is the skin around the exit site may be pink, similarly to the healing scar, or may have brownish or purplish discoloration. That's your fourth point. And your fifth point is look for the signs of infection. And for those signs of infection, you have to look for erythema, you have to look for induration, and then tenderness. Okay. And last is catheter and connection should be inspected for integrity. Got it? Those are your 6 points. Okay, so tell me again, what is peritonitis? What is peritonitis?
Ma'am, inflammations of
Inflammation of
peritoneal
the peritoneal cavity.
Okay. Yes, okay. So what are the signs and symptoms?
Abdomen pain,
Mhm.
nausea and vomiting, and clotting.
Okay. Yeah. Any more? Anyone? Anyone else?
Ma'am,
Diarrhea.
lost ultra
Diarrhea.
filtration,
Okay.
low drainage.
Just abdominal pain, nausea, vomiting, diarrhea, and then what else? Lots of ulcer inflammation and low drainage. Okay. So that is it. And then what are your exit site infections? Yes.
Yeah, damn, right to top of school.
Someone who's making noise, please mute yourself. What is your first point for exit site infection? Okay. You don't have to give me the full sentence, just give me like, just in simple, like in your own words. I just want to know if people understand. What's your first point? Yes, what's your first point? Bhabaglam, tell me what's the first point? Yes, Bhabaglam.
The exit site of dressing shall not be changed after 5 to 7 days.
Yes. Until there is what? Excessive drainage. Okay.
Until there is excessive fluid coming out. Yes, ma'am.
Yes, okay. Thank you. So what's the second point?
First
Anyone else?
dressing should be done.
Yes, tell me.
First dressing should be done or performed by a trained person.
And then?
Mask is compulsory.
No, that's same point. after when you're doing when you're performing it, who should you teach? You should also show them.
Patient.
Right? Yes, you should also show them. Don't forget that you also have to show them. And then next will be who should I ask? Yes, Rifkin, tell me the third point. Rifkin, tell me the third point. What is the third point? Yes, Rifkin, what is the third point? Unmute yourself.
Hello, ma'am.
Yes. What's the third point? The network is not clear. Okay, forget it. Yes, Ishan, tell me what's the third and fourth point. Give me 2 points. Third point and the fourth point. Ishan. Yes, Ishan, tell me.
Whenever we do dressing, we should wear a mask.
Yes, okay. And what's the next point? Give me any point.
We should
You should point. What color should your healing scar look like?
pink color.
Okay. Okay, give me the what was the first point? Next point, give me.
Ma'am,
What
I
should you
don't
look for? You don't know? What was I showing you just now then?
Yes, ma'am.
Okay, Virginia, give me the first point.
Catheter.
Okay, what happened to the catheter? What should you check? What should you look for? Miss Srijana,
Yes, ma'am.
give me what's the fifth and sixth point. You have 2 points left. Give me 2 points.
Ma'am, look for the signs of infection
Yes. And what are the signs
and
of infection? What are the signs of
erythema,
infection?
induration, and tenderness.
Okay. And what's the last point?
Catheter and connections will be checked for infeculty.
Integrity. Okay, it's integrity, okay? So what does integrity means?
Okay, ma'am.
What does
Ma'am,
integrity mean?
stability.
Yes. Okay. So that's it. That's it for today's class. Okay. I'm not taking your afternoon class. I'll send you your notes and then you can write down your notes. Okay.
Okay, ma'am.
Thank you. I hope you understood that part of it. Yes. Okay. Thank you.
Ma'am.